today's speech, I'm going to talk about why you should donate blood to save a life. You have just been in a car accident. You were thrown from your car with broken bones and multiple lacerations throughout your body. You are losing blood and consciousness. The EMTs come to the scene and take you to the nearest hospital. You have lost a lot of blood and need more. What happens next? The hospital will give you a blood transfusion, but where do you get the blood? How does it get to the hospital to save you? Who donates the blood? What type of blood is there? In today's speech, I will talk about the importance of donating blood to save a life. So the first thing I'm going to talk about is what are the benefits of donating? So some of the benefits of donating blood are from the American Red Cross. One donation of blood can save up to 3 people. Think about this. If I donated blood today, I could save 3 of you in this room from dying. Would you want to be the one to save a life? The next benefit is from America's Blood Center. 1 in 7 people entering the hospital need blood. You go to the hospital to find out what is wrong with you or to get treated for something. Can you imagine if you went to the hospital and couldn't get blood because not enough people donated? This is a scary thing to talk about, but it shows the seriousness of why it's so important to donate. The next reason is every 2 seconds, someone in the United States needs blood. In the time that it took me to say this sentence, 10 people already need blood to survive. Giving blood helps someone live another day, and we take that for granted every day. This is from the American Red Cross. So, in the time that's been taking me to say this speech so far, we could have saved 20 people from living another day. What is the process of donating blood? When you're donating blood, there are 2 types of blood donations you can choose from. The first one being whole blood donation. So as you can see on her arm, she has the IV in her arm. This is the normal donating blood. From American Red Cross, whole blood is the most flexible type of donation. It can be transfused in its original form or be used to help multiple people when separated into its specific components of red cells, plasma, and platelets. Whole blood is frequently given to trauma patients and people undergoing surgery. You are able to donate whole blood every 56 days, and the process takes less than an hour and is the most common. Second way of donating blood is called the Power Red donation. The Power Red donation gives you a concentrated dose of red cells, the part of your blood used every day for those needing transfusion as part of their care. This type of donation uses an automated process that separates your red blood cells from the other blood components and then safely and comfortably returns your plasma and platelets to you, according to the American Red Cross. So in Power Red donation, it takes a machine, puts the IV in you, and takes your red blood cells out, and then when it's taking your platelets back in, it puts saline through, so it's only taking the red blood cells out. This process takes a little bit longer. It's an hour and a half, and you can only donate 3 times a year or once every 112 days. So the next question, why wouldn't you be able to donate blood? So let's say you go to the center to get your blood taken and you're registering with all your information. One of the questions they're going to ask you is, or how are you feeling? Are you sick? Do you have low iron supply? Have you been outside the U.S.? According to Dr. Flaherty, medical doctor, article written International Travel and Blood Risk and Restrictions for the Journal of Travel Medicine, says that if you get a disease such as the West Nile virus, you cannot donate blood until 6 months after recovery. So if your recovery takes 2 weeks to get rid of West Nile virus, then you can't donate blood until 6 months from that 2 weeks. Also, if you have hepatitis E, you cannot donate blood for 12 months after recovery. So again, if it takes you a month to recover from hepatitis E, you can't donate blood from a month from recovery for a whole year. Now, how does the blood go from your arm to the hospital? So how do we get this? After you donated the blood, so you donate, you're going to American Red Cross or to a blood drive to donate your blood. After you get your blood drawn, it will go to processing. Depending on the type of donation you did, depend on where your blood goes. They are packaged and sent for testing. The blood is tested for what type of blood type you have and if there are any diseases. So let's say you donate blood, it goes for testing and you didn't know it, but you have cancer, or you have hepatitis E and you didn't know it. When they test your blood, they'll be able to test to see if you have any certain diseases. When they test that, and if you does have it, they will throw it away. But they will let you know that, hey, you have this type of disease, you have this type of formality that we cannot take your blood. They won't just throw it away and not tell you, and then you're find out. Once they've done all the testing, they then store it in refrigerators at the American Red Cross or a distribution center where holds all the blood. Now, next step is distribution. So you're thinking, if every 2 seconds someone needs blood, the blood doesn't stay very long in the storage. So it goes to distribution. The American Red Cross will donate the blood every day, 24 hours a day, 7 days a week, depending on if the hospital calls. So if there's a major event that happens and they, like Hurricane Katrina or September 11th, and you know you're gonna have a lot of casualties and you're gonna need blood, American Red Cross will bring that blood to you. And the last step is transfusion. So when you are at that hospital and you need the blood, you got into that car accident, something happened to you, you need your blood transfusion. According to the American Red Cross, blood transfusions are given to patients in a wide range of circumstances, including serious injuries such as car accidents, surgeries, childbirth, anemia, blood disorders, cancers, and many others. So all this information I gave you seems like a lot, but you can also find out more information at the American Red Cross website, which is www.redcrossblood.org. And there you can find all different ways about what we talked about, how to donate blood, the different whole blood or red blood power donation. Next thing, where can I donate blood? So like I've been talking about, you can donate blood at the American Red Cross. You can have a local blood drive. So if people are in need of blood, they will have blood drives. And around in our local area, in Toledo, they do have a center where you can go and donate blood, or you can donate at your local hospital. You can also volunteer for the American Red Cross to help with blood drives. To recap what we went over today, we talked about the process of donating, why it's important, and where you can donate blood. If you could take 30 to 60 minutes out of your day to help millions of people who need blood, would you do it? Donating blood doesn't just make you feel good about donating, but it saves lives. Think about it. It could be your family member who needs the blood to survive, or even you. I hope you learned a little bit about why it's important to donate blood, and hopefully you'll donate blood also. Thank you. I think it was like 9 minutes.